We've got some visuals. We're hoping that this is going to work. And so let's go to our teleprompter and see if we can illustrate what's going on here, Vance.
Well, what we're looking at here is that you're actually in the operating room now. And I'm the person closest to you, and then you see my assistant right next to me. And I'm looking in the microscope. You can see the microscope there that I'm looking at. And then down here, you see the actual cornea. And we're going to be operating on that. And we're going to be going inside that eye. And basically what happens with that surgery is we make an incision in the outside part of the eye, right about there. And we're going to go ahead and do that so that we can get access to the inner eye. And then after we get access, and we be sure and make that cornea, keep it nice and moist while we're operating on it. And then after we get access to the eye, then we go inside the eye. And with this device we're doing right now, this is actually called the Zepto technology. And this is going to help us get access to that lens. And it's almost like a cookie cutter. It makes a perfectly round opening. And then once you go ahead and you discharge it, this makes us so we can get to the cataract. And then we take it out with actual ultrasound, and we remove the lens. And then it's time to do the implant. And this shows the implant. If we want to watch the actual implant going in, we've just made the capsulotomy, or that nice circular opening in the capsule with the cookie cutter. And now we're using the ultrasound to remove the cataract. And then now we've cleaned out the capsule and we've made a home for the implant. And the implant's going in right now. It's made out of acrylic or silicone. We can put them in 2-year-olds and we can put them in 90-year-olds. This material lasts forever, and then it unfolds and then it's in the eye. And that is what refocuses light for you after cataract surgery.
So I always thought that those implants were rigid.
Right.
But they're not. I mean, they're tiny little things, and then they just expand once they get in an open space.
But you're right. That's how they started out, as rigid. So you had to put them in through a larger incision. And you remember the days when they talked about you had to be in the hospital for 2-3 weeks and sandbags, and how cataract surgery used to be such a long healing period. It was because of large incisions. And as we got smaller and smaller and smaller, and then when we were able to fold it and put it through a micro incision, recovery has become so, most people are back to work the next day.
Oh, yeah, wow. That's right. I mean,
I talked to one of my patients coming up here. I like to call my patients after surgery. And he was already doing some phone calls and work with his office, and he had cataract surgery 4 hours ago.
Wow. That's fabulous.
Yeah.